cardiac disease remains very important, but there's now a focus on stroke, and we'll see this in the newspapers, and you can have seen this recently, and preventative heart disease. And within the new areas of stroke is the development of identifying patients who have an irregular heart rhythm called atrial fibrillation and treating them properly with blood thinning medication. So traditionally these patients were treated with aspirin, but now the recommendations are to treat them with formal anticoagulation, something called warfarin. And unfortunately warfarin has negative connotations because it requires regular blood tests, it requires you to avoid certain foods, and it's a bit of a nuisance. Although it's very safe and well regarded, for patient compliance purposes, it's a bit of a nuisance. And new drugs have come on the market, and these have been in the papers recently, the new factor Xa inhibitors and the direct thrombin inhibitors that don't require blood tests, that thin the blood, that are once or twice a day. And these are excellent products, but their assimilation into the NHS is difficult because they're very expensive. They cost about £100 a month, while warfarin costs about £15 to £20 a month, including all the blood tests. And as a consequence, the cost burden to our health service is quite significant. So I've been involved with the introduction of these products into Essex by writing policies as network lead, and I'm very much interested in these products because I think they will substantially reduce the risk of stroke in the future, particularly in this patient group. And I'm also very interested in identifying this patient group, which is also some policy work that I've been doing in terms of pulse screening, where GPs are asked to check the pulse on everybody who comes into their surgery as a matter of routine to identify whether they've got this condition or not and therefore at risk of stroke.